Good morning and welcome to the Insight APSAD webinar series. I would like to begin by acknowledging the traditional owners and custodians on the land of which this event takes place. I'm coming to you today from Meanjin on the lands of the Turrbal and Niagara people. I'd also like to extend that acknowledgement to any Aboriginal and Torres Strait Islanders who are joining us today from across the web. My name is Sam Clark and I'm one of the nurse educators here at Insight, and I have the pleasure of facilitating today's webinar, What do Queen Victoria and whippits, not corgis, have in common? Our presenter today is Dr. Jeremy Hayllar. After training in general medicine and gastroenterology, Jeremy spent 10 years at Mount Isa Hospital as Director of Medical Services and a general physician. In this hard drinking mining community, his interest in substance use problems developed. Since 2004, he has been Clinical Director of the Alcohol and Drug Service for Metro North Mental Health. His interests include treatment of opiate use disorder and the interface between addictions and mental health. Dr. Jeremy Hayllar is the Clinical Director here, and I have the pleasure of handing over to him to start the webinar on what do Queen Victoria and whippits, not corgis, have in common.
Thanks very much, Sam. So welcome everyone. And this is a talk about nitrous oxide. I've asked the question, is it addictive? We'll give you some historical perspectives. Always good to look at the past and how things were. A bit of pharmacology, and later on we talk about other uses which are being advocated, but I think they have little substance. We'll talk about the harms, and there are a few case series out there. We'll mention B12, vitamin B12, because as you'll understand, this is centrally involved in many of the harms from using nitrous. I will briefly present a case from Brisbane, some harm reduction tips and a summary, and I don't have any disclosures relevant. So I think I might be addicted to nitrous. I took my first whippet only 2 months ago. Since then, not a single day has gone by when I haven't puffed balloons. And if you don't understand that, I will explain later. I've known about the dangers of B12 deficiency since day one. I just can't stop. I've spent so much money. I've gone through thousands and thousands of these things in the last 2 months. I can't stop myself. I make pretty good money at my job. Money hasn't been an issue. All of a sudden, I'm totally broke for the first time. I just ordered yet another 600 pack, even without I couldn't wait. So I went down to my local head shop and spent the last $90 in my bank account on a 100 pack. It's so bad, the guy working there immediately recognized me, asked me how many I wanted as soon as I walked in the door. My trash bags are completely filled with whippets. My legs and feet are numb, and I'm having trouble walking. I don't know how to stop. So that's quite a worrying picture, you'll agree. That comes from Reddit on addiction. And this is from a recent paper published from Australia. A notable recent example presenting to us is of an affluent 19-year-old international student who came to the emergency department, thought disordered and unable to walk or use her hands. She had been able to afford and access $750 worth of nitrous oxide, charging canisters per night for 7 consecutive nights. So a very short, very large exposure leading to adverse consequences, both psychotic thoughts and peripheral neuropathy. Let's go back in history a bit. So Samuel Taylor Coleridge, a poet, wrote to Sir Humphrey Davy, an early chemist. The first time I inspired the nitrous oxide, I felt a highly pleasurable sensation of warmth over my whole frame. The only emotion which I felt inclined to make was that of laughing at those who were looking at me. My eyes felt distended, and towards the last, my heart beat as if it were leaping up and down. On removing the mouthpiece, the whole sensation went off almost immediately. So here we have the description of a rapid onset and rapid offset. And let's not forget that Coleridge wrote Kubla Khan, which was probably under the influence of opium. So he had a dream where the poem was projected onto a screen in front of him. He was writing it down, and a gentleman from Porlock arrived and knocked on the door when he got to line 52 and interrupted him, and the poem was never completed. Anyway, that's a bit of an aside. So what are we talking about? Nitrous oxide, N2O. It was discovered by another early chemist, Joseph Priestley, in 1772. And he later on in 1774 allegedly discovered dephlogisticated air. He developed a theory that once air in a jar could not support a candle, the reason was the saturation of this air atmosphere with phlogiston. Now, Lavoisier, who was a Frenchie, showed this was actually due to lack of oxygen. And the Brits were very upset at this and felt the French were imposing their beliefs. So there was a bit of a spat going on in the late 17th century, 18th century. Now, then nitrous became popular at laughing gas parties in the 19th century, and we've mentioned it inactivates vitamin B12. So that's one of the key adverse consequences. Here you can see the bulbs and the balloons, which are integral to consumption. And one of the problems is they're creating a lot of litter around the place, which is upsetting the politicians. So I did mention Queen Victoria at the start. I came up with this title because I'd mistakenly recalled Queen Victoria having some sort of inhaled anesthesia, stroke analgesia during labour. And it wasn't nitrous that she had. It could have been, but it was actually chloroform. Anyway, there are some similarities. So during the birth or the labour for the arrival of Prince Leopold, her 8th child, poor thing, in 1853, she was allowed to inhale chloroform for 53 minutes. Blessed chloroform, soothing, quieting, and delightful beyond measure. So she quite enjoyed it. So although it wasn't nitrous, it was another recently discovered inhaled gas providing pain relief. The first use for nitrous was for dental anesthesia, and it's still used for that purpose. I remember when I was about 11 having a dental procedure, and I'd cycled into the dentist on my own and I wobbled home after receiving nitrous. So although the acute onset and offset may be dramatic, there was still some residual unsteadiness, I figured. So the first use described was in 1844. Here is an image of Dr. Syntax and his wife making an experiment with pneumatics. And here you can see the device which is delivering the nitrous to the assembled party, who seemed to be consumed with hilarity at what was going on. And that may be where the term laughing gas comes from. This is a laughing gas party in the 19th century. Now, the pharmacology of nitrous doesn't seem to be fully understood. It's a colorless gas with a slightly sweet odor. It's very lipid soluble, so that means it enters the brain, the CNS, very rapidly. Its analgesic action is blocked by naloxone, so it's working on the mu, particularly delta and kappa opioid receptors. It mediates the release, in addition, of beta endorphins, and it's described as a dissociative agent. So it may be that the action on glutamate NMDA as an antagonist, which is shared with ketamine, is the process by which dissociation occurs. It's neurotoxic in rats, so that raises the question of the long-term effects on memory and cognition in humans. So what are we using nitrous for these days? Well, it's used in labour. Entonox, you may be familiar with, is a 50% mix of nitrous and air, and oxygen. So it's used for analgesia during labour. And the patient holds the mask delivering this gas mix to their face, and it's kind of protected from overdosing, because if they kind of lose their ability to focus, then the mask will tend to drop from their face. They'll cease to inhale, and the effects will wear off quickly. It's still a component in general anesthesia. And as I mentioned, dental procedures and painful dressing changes. It causes good anxiolysis as well, which is interesting. And there are some reports of erotic hallucinations, so charges being leveled against dentists for doing their job, not for any sexualized behavior, but the hallucinations nevertheless created that impression. It's used as an additive to fuels for racing cars and rocket engines, increasing the thrust. Of course, the production of fluffy whipped cream. And for $12, you can get 10 of those little steel canisters with a $10 delivery charge. And because it's found to inhibit bacterial growth, it's also used elsewhere in the food industry. Just going to the most recent household survey from 2019, I know this is very small print. Inhalants is as far as it goes. We don't break it down any further. What you can see here from 2001, 0.4, in 2010, 0.6, and here we have 1.4% of the population, a significant increase in 2019. And of course, we're waiting for the results of the 2022 survey. And it's believed that about 60% of those inhalants are actually nitrous. So we do have an increase in use from that evidence. The effects of nitrous, well, euphoria, as we've seen described, sedation, dizziness, confusion, as you'd expect, blurred vision, incoordination, as I experienced that day at the dentist or after the dentist, sweating, tiredness, hypertension, and indeed sudden death. Long-term tinnitus, incontinence, spasms in the limb, numbness in the peripheries, which may be B12-mediated dependence. I think it's clear from that very first Reddit note that I read out that dependence is really a significant risk. Depression, psychosis, another interesting feature, that second case, the lady had been using very heavily for a week. And the causes are mainly a result of B12 deficiency. Why do we use nitrous to whip cream? Well, under pressure, nitrous is absorbed into cream to increase its volume by about 4-fold, and it creates thereby a highly prized and fluffy texture. A range of alternatives have been trialed and none seem to be suitable. That includes the hydrofluorocarbons, carbon dioxide, which curdles the cream, alcohol leaves a unpleasant taste residue, and oxygen, which turns the cream rancid within 30 minutes. So as I mentioned, along with ketamine and methoxetamine, nitrous is described as a dissociative substance, and this is the sort of wheel of effects. Interestingly, cannabinoids has its own chapter in this wheel. So what's actually going on once you start inhaling nitrous oxide? Well, there are two important effects when you block the action by oxidizing vitamin B12. Firstly, you inhibit the production of methylcobalamin, so that's an activated B12, and that involves the creation of methionine from homocysteine. Now, methionine is a very important methyl donor, and methyl groups are very valuable in the methylation, particularly of the nerve tissues. So that's the first effect, which may explain peripheral neuropathy. The second effect is to inhibit the production of succinyl-CoA from methyl malonic acid. Now, I mentioned these two because what we will see very shortly is that some patients have a normal vitamin B12 level, but very high levels of homocysteine and methyl malonic acid, implying that the B12 is unable to affect the translation of homocysteine to methionine, methyl malonic acid to succinyl-CoA. Now, SCA, that feeds into the Krebs cycle or the citric acid cycle to generate energy. So it doesn't seem to be quite as critical effect as we see with the loss of methylation function. So I mentioned those two products. So methyl malonic acid, here we have the normal range up to 280 in a patient using nitrous, a grossly elevated methyl malonic acid at nearly 10 times the normal upper limit, and likewise the homocysteine level more than twice the normal upper limit, where the B12 level is actually within the normal range. Then we see at follow-up after active treatment at 6 months, B12 levels highly elevated, and the methyl malonic acid and homocysteine are back to normal. So successful effective treatment. Now, it hasn't always been thus. So those laughing gas parties, they didn't really notice the long-term adverse effects, which can be seen within a week, as we've shown. The earliest reports of harm came from 1956. There were 2 publications in 78. And Dr. Schilling, whose fame resides in the Schilling test, which was used to diagnose pernicious anemia, the autoimmune condition that leads to B12 deficiency. Anyone who's a fan of Dr. Finn's casebook will recall patients being asked to eat raw liver to replenish their supplies of B12 in the early days, that was. He wrote of 2 patients with a low B12 given a general anesthetic containing nitrous, who then developed adverse consequences. And I'll also describe cases from 2004, more from 2013, 19, 20, and also from Melbourne in 2022. So this is the title of Schilling's paper from 86, 2 women developing significant neurological dysfunction consistent with subacute combined degeneration of the spinal cord, which is the effect of B12 deficiency after being anesthetized with nitrous oxide. So they had a preclinical or masked B12 deficiency, and the clinical effects were precipitated by the nitrous oxide administration. And then we have a paper from 2004. This is a young man who had inflammatory bowel disease. He'd undergone a colectomy and an ileostomy with a pouch. And unfortunately, as happened particularly in the early days, there was pelvic sepsis. So somewhere there was an anastomotic leak and ongoing pelvic sepsis with weekly drainage, which was very painful. So he was sent home with his drains in place and a cylinder of nitrox. And his intake gradually increased to 1,280 litres per week, which actually is only 160 nangs, which, as some of you may be aware, is barely getting started with a heavy session. However, because of the consistent and ongoing use, and possibly with terminal ileum malfunction with this inflammatory bowel disease, Crohn's disease typically affects the terminal ileum, he wasn't able to replenish and use B12, and he developed weakness and paresthesia, was unable to walk, and was admitted to hospital for IV B12. His symptoms settled and he made a full recovery, which was fortunate. So here's a more recent review, a systematic review from the US, which describes 91 cases collected up until 2016 of people using nitrous oxide to excess. And 72 patients had neurological complaints. The most common was numbness and paresthesia, closely followed by weakness. Some patients had bladder and bowel dysfunction. Some of you may be familiar with Lemaitre sign, which is the feeling of electric shocks going down your back into your limbs when you flex your neck. So it's a sign found in multiple sclerosis where there's demyelination. And those methyl groups in B12 deficiency are important for repair and protection of the myelin sheath. 11 out of 91, so more than 10% had a primary psychiatric presentation and 7 had delusions. There were a number of deaths in these reported case series. Of course, if you die using nitrous, I guess you're more likely to be put in the literature. And typically it's hypoxia or asphyxia. And we've heard of the deaths due to inhalants, people huffing or placing their head in a polythene bag. So they develop hypoxia and asphyxia. Now, many of the cases, the symptoms did improve, although by no means all, 10% or so, they resolved entirely, and 3 have persistent symptoms. So a mixed picture of recovery. Now, this is a paper from Melbourne, Paul Haber and colleagues, and I would flag that Chris Tremonti has been invited to talk at WOWS coming up in a few weeks, so don't miss out. So vitamin B supplementation is futile for preventing demyelination. So this is a really important point. This is showing an MRI image of what's called the inverted V sign. So for some particular reason, B12 deficiency affects the dorsal column, so the rear of the spinal cord, and it leads to this sign, the inverted V sign, and those are the 2 dorsal columns which light up on MRI and seem to be quite a strong marker for this problem. So they went on to describe the 7 patients they'd seen at RPA over the course of a year. And many of them had the inverted V sign. Most had low or low normal B12, but some had completely normal B12 levels. They all had high homocysteine levels. And what's very striking is 4 out of the 7 patients had actually been taking supplementary B12. Nevertheless, they developed severe symptoms. So when you have a modified Rankin score, 5 is severe disability, bedridden, 6 is dead. Now, none of these have died, but 4 had moderately severe disability, unable to walk or attend to bodily needs without assistance. And you can see 4, 4, 4, 4, 4, 4. So there might have been some improvement, but their Rankin score didn't actually change. Just going to the number of canisters, you'll remember the guy with inflammatory bowel disease earlier, using about 160 equivalent per week. These guys were using well over that each day, mostly young people, and that is quite typical. And the duration of use was a lot more than a week, as we saw with that earlier case. So I think this is a particularly important description of a case series where people who thought they were going to be smart and supplement with B12 weren't able to prevent the complications of daily nitrous use. This is a paper from China where nitrous seems particularly popular, whether that's because of life under the Chinese Communist Party, I hesitate to judge. So young people, males and females alike in incidence. And what we can see here is in light grey, the number of patients. So up until 2016, there had just been one. And then in 2019, they had 48 presentations. So really quite a dramatic increase in the number of patients presenting, young people, with consequences of nitrous use. Here we have a paper just published last year from Melbourne again, and they described 13 consecutive cases over 4 years. And interestingly, 2 of their patients actually got worse after administration of B12. I don't know that there's an explanation for that. 5 were international students, and apparently that constitutes a major market for the retailers of NANGs. That's the abbreviation for, or the term to describe those whippets, those little cylinders. And they recognize isolation of these students, lack of family support, and stress about studies as kind of precipitating factors. And 7 were local people, all with prior mental illness or substance use disorder related issues. So just standing back for a moment, I want you to take note that this is Mark Gilman, and we'll see his name coming up. This is from a paper in 1990, describing how they have used nitrous oxide for alcohol withdrawal for 10 years in over 7,000 cases. And when they say use nitrous, they are giving about a 45-minute exposure to nitrous. And they say this shortens the duration of withdrawal symptoms, reduces the need for benzodiazepines, and increases the opportunities for people to go early to residential rehabilitation. So slightly bizarre, you'll have to agree. Now, the same guy, Mark Gilman, 32 years on, is still talking about nitrous. And it does seem to be a bit of a South African thing, because I couldn't find anyone else advocating its use. Perhaps it's a particular feature of being in South Africa that's effective. So he describes possible uses for nitrous in psychiatry, withdrawal management, treating depression, investigating schizophrenia and the human orgasm. Remember, we talked about those erotic hallucinations earlier, and investigation of pain perception. So he does seem to be a kind of sole advocate for this approach to life. Here's a study where they tried to use nitrous, looking at sleep quality during alcohol withdrawal. They had over 100 patients. They actually gave some of them 45 minutes, as I mentioned earlier, of nitrous oxygen mix, and they compared it with those who had air oxygen mix. And there was actually no difference in sleep quality. What did make a difference was the height of their alcohol withdrawal score and their intake of coffee. So those 2 are entirely plausible. The nitrous didn't make any difference at all. So time to talk for a moment about vitamin B12. The structure was revealed by Professor Dorothy Hodgkin, who became a Fellow of the Royal Society in London and also got the Nobel Prize for medicine. She was able to reveal this structure, and you can see that it's pretty impressive in 1948. What we have in the center is this cobalt molecule, and this was the first naturally occurring biological molecule which showed a bond between a carbon and a metal ion. Now, this structure here, the tetrapyrrole ring, is very similar to that found in hemoglobin, where instead of cobalt, we have iron in the middle. So nature kind of being fairly conservative, holding on to that ring structure. Dorothy Hodgkin used X-ray crystallography to show this structure, which was a newly developing science. And the fact that there was cobalt present made the X-ray crystallography very challenging. Lawrence Bragg, a well-known Australian scientist who worked in Cambridge, described this as a significant a breakthrough as breaking the sound barrier. Prof. Hodgkin also revealed the structure of cholesterol and insulin. Insulin, being a long chain molecule, took 35 years for her to work out the structure. And her one other claim to fame is, some of you may know that Margaret Thatcher did a degree in chemistry before she embarked on her career in politics, and Dorothy Hodgkin taught her. I don't think she can be held responsible for the later political views that Margaret Thatcher formed. So what is being done And I noticed in the Guardian Online yesterday that the UK, in its wisdom, has just decided to prohibit nitrous oxide being made available for substance users. So I don't know all the details, but the article pointed out that 25,000 people in the UK die from tobacco use, from alcohol use. About 60,000 people die from tobacco use, and on average each year 4 people die from using nitrous. So as you'd expect, the government has got its priorities completely upside down. In Australia, the other thing in the UK is that actually reported use of nitrous has halved in the last few years. So it could be that word is getting out, and it may be that although we saw a jump in nitrous use in Australia in the NDS household survey, maybe following behind the UK and the US, we will see in coming years a fall off as kind of word gets out. So the TGA has changed the poison schedule with an amended entry. This is in Appendix F, Part 3, saying that it may cause irreversible nerve damage if inhaled, and asking people not to intentionally inhale the contents. I don't know about you, but I don't think many young people are familiar with Appendix F, Part 3, new entry. So what about what's happening at the state level? In various states, it is an offence to supply nitrous canisters for non-medical human consumption. In South Australia, it is an offence specifically to sell to anyone under 18 between the hours of 10 p.m. and 05 a.m. or to display it in retail stores. However, despite that, the delivery services around the country seem to be very, very active, and that is both based on the internet searching and also reports from individual patients. So I think rather than trying to prohibit the use, we need to educate people more about the potential harms. So here's the Nangs Brisbane, #1 seller in Brisbane, the most trusted delivery provider. Get crackers, cream chargers, and I think we'll come to that on the next slide, and tanks and Nangs delivered across Brisbane in 30 minutes. So there's the number up there for anyone who wants to try it. So each Nang, and that's each of these little steel cylinders, contains about 8 grams of nitrous, I don't know what it says on there, in 10 cubic centimeters, cc's. And that is under pressure. So when the pressure is released, that's producing 8 liters of nitrous, normal pressure. So if you go onto Amazon, what you can find are these whipped cream chargers, which take these 8-gram Nangs. And here's a range here with prices to match. So they look quite posh, don't they? And you can see those being used in the catering industry. You're effectively screwing your Nang, and this is the trigger which releases nitrous. And you may have cream in here, which receives the nitrous and then comes out of the spout. Or alternatively, you may just release the nitrous into the cylinder and then release the nitrous from here in a controlled manner when you place a balloon on the end, as is shown in this illustration. So this takes us to the patient I mentioned earlier. And I was involved actually 2 years or so ago in a patient at Royal Brisbane, who I think was 16, who had been using nitrous very heavily. And she lost function completely in her legs and was admitted immobile and unable to walk. And in the presentation, which was combined with Gen Med and Neurology, we had some video of her slowly regaining function in her lower limbs. So it was really a very dramatic picture in a young person who'd been using heavily. So this is also a young person, a 20-year-old female, seen in clinic. She'd been using Nangs for 18 months, up to 420 a day. So that's about $500 worth. She complained of difficulty walking, numbness in her hands and feet, and also urinary difficulties. Now, quite how she found the time to use all these things as well, I have no idea. So a bottle of spirits a day, she was using Suboxone from the street, smoking 20 cigarettes a day, Alprazolam just once or twice a week, and codeine at weekends. In the past, she'd had overdoses with propranolol. She'd been in HADS, where she discharged herself after a couple of days. And on the viewer, she had 58 pages of presentations. Each page has 10 presentations. So that really means 580 presentations over about 6 years, which included 1 year under the care of Kim's as an inpatient. So this is clearly quite a distressed and disturbed young lady. She had a range of diagnoses: complex trauma, childhood sexual abuse, borderline, not surprisingly, suicidal ideation, overdose and cutting, aggression when intoxicated, Tourette's, an eating disorder, POTS, this weird cardiological problem with hypotension, a functional neurological disorder, which manifests as pseudo seizures or seizures, urinary retention, as I mentioned, and reflux. So we've been treating her with long-acting injectable buprenorphine. She's on an antidepressant, she's on clonidine, an antipsychotic, another antipsychotic, and another antipsychotic. And she's also on B12 orally, though, as we've discussed, really that doesn't seem to prevent the harmful consequences of nitrous use, as long as the nitrous use continues. And what happens, she wasn't taking it currently because every time there's an emergency with an overdose or another crisis, QAS come into her flat and remove all her medications, including the B12. So she doesn't always replenish their stores. A week before I last saw her, which was about 3 weeks ago, she tried to jump off the Story Bridge. The night before we saw her, she had climbed onto her second floor balcony. So QAS was below with 4 QPS vehicles on scene. So this is a very troubled young woman, and she has heavy support from NDIS. The support worker came to the consult very worried. And she had at this stage largely ceased using nitrous. And what rather surprised me was a case review by mental health had determined that her case should be closed. The patient said she wished to re-engage, and I took the liberty of contacting her mental health case manager and consultant. And I was a little surprised at the response. Our position isn't changed by new information. I'd said she wanted to engage. Despite what she may disclose, her engagement with the service has been poor, not therapeutic. We're of the opinion that continuing to provide her with a service she's engaging with is only further enabling maladaptive behavior and longitudinally increasing her risk of suicide. If she does wish to engage with mental health services, the re-entry path for her will be via contact with MH Call and an initial intake. They will then determine if she's suitable for a referral to the ACT team, and will go from there as per her acute management plan. So I found that a little surprising that a service with someone who's clearly actively suicidal, self-harm, could refuse to see her. So Neptune is a report from the UK about novel psychoactive compounds. They have a chapter on nitrous, which I quoted earlier. And this is their harm reduction tips for anyone who does decide they wish to continue using. Users should always inhale from a balloon, never from a tube or a mask. As you'll know, when you release gas under pressure, it comes out at a very reduced temperature as it kind of releases into the ambient atmosphere. And those cold temperatures can cause cold burns. So that's the reason for that advice. Users must be careful not to confuse nitrous with other gases or volatile substances, which may have far greater risks. So one thinks of butane and other propellants, which can be very flammable, for example. Users should avoid inhaling while standing up and should be aware of their immediate surroundings. So you might say this is pointing out the bleeding obvious, but don't use nitrous when you're standing above a steep drop, beside a fire or a river. Avoid the use of nitrous when someone's got a low blood pressure or a mental health issue. Users should stop inhaling if they feel any physical discomfort, pins and needles, or numbness. I guess that refers to the signs of B12 deficiency. Regular long-term users in particular should be aware of the purity of the products they use and of the impact of any impurities. So, you know, some perhaps plausible harm reduction tips there. So what are we saying in summary? Firstly, don't confuse it with nitric oxide, So nitrous oxide is different from nitric oxide, which actually is a short-lived chemical messenger in the body, which causes vasodilatation. So it's found particularly in the endothelium of blood vessels. And when it's released, it vasodilates to surrounding smooth muscle. So that's got an important role to play. And some patients in intensive care are managed with inhaled nitric to help perfuse their organs. So what we found today is that nitrous provides a brief, self-limiting rush of euphoria, which people find very pleasant. NANGs still seem to be readily available with a home delivery service at all hours of the day. So clearly regulations are not working. And at the moment from NDS, use seems to be increasing, although inhalants aren't differentiated from other volatile substances. Nitrous blocks 2 or more crucial coenzymatic steps, which are involved in the function of B12. Now, it's also suggested that B12 has an effect on cytokines, which are inflammatory mediators in the body, such as tumor necrosis factor alpha and interleukin 6. So some of the consequences of B12 being inactivated may be due to effects on these two and other cytokines. Serious neurological complications may result, as we've seen, and this includes psychosis and peripheral neuropathy. And I'm afraid quitting is really the only plausible and viable answer. B12 supplements really don't seem to help if use continues, because use continues to inactivate B12. An important point is that you can take a high dose, that's 1,000 micrograms of cyanocobalamin daily as an effective means of supplementing low B12 levels. You don't have to have it by injection. So I think this makes compliance easier. My wife's vegetarian, so I encourage her to take B12 tablets rather than having monthly injections. It's fairly cheap, so you get about 60 tablets for $15 or $20. So I think it's much preferable to having iron injections. And sometimes, as we described above, the B12 appears not to ameliorate things, but make things worse. And that's where giving a methyl donor, such as methionine, and some of you may be familiar with N-acetylcysteine, that's another methyl donor used in paracetamol poisoning. So oral methionine can be used as well. So that's a methyl donor, which helps to supplement the production of methyl donors for repairing and growing the myelin sheath. So I think that's all the slides for this morning. I'm happy to answer any questions, and I can see some chat online, so we'll have a look at that as well. So thanks for joining us today.
Thank you, Jeremy. We do have a few questions in the chat that have arose throughout the presentation. One of them says, we work with people who use the 1 litre tanks. What is the equivalent in canisters?
Right, well, I'm afraid I can't answer that, but I'm sure a litre is a hell of a lot more than 10 cc's, which is 100th of a litre. So a litre is 1,000 cc's, so that would be 8,000 litres. So that's an awful lot of nitrous. So that is my answer, an awful lot.
Yes. Yeah. It's
Someone's asked what is WOWS. Can I tell you, WOWS is Walk on the Wild Side. So that is the annual symposium we run for people working in the alcohol and drug sector. And we've got a great program coming up this year. The date is, yes, we'll clarify the date shortly.
I've just popped the link in case anybody doesn't have the link to go to where you can book tickets for WOWS.
There it is. Thank you very much.
Access to that, no problems. There's one question that says, are there repeat presentations with worsening of clinical symptoms? So, for example, if somebody stops using nitrous oxide and B12 administration occurs and there's a resolution of symptoms, if use of nitrous recommences, then is there the chance for a more rapid onset, or is disease progression faster, or is it kind of back to normal?
No, I think that there's certainly a risk of more rapid onset. that there are cases described when people are advised of the etiology of their symptoms, and they're treated and they recover and they're discharged and then they're back again. So I don't know whether that qualifies as reinstatement. I suspect it doesn't. However, I think we certainly have to grasp the fact that this is nitrous use disorder is a real thing, and there is a nitrous dependence that can develop.
Yeah, I wasn't sure if it was, you know, like cannabis use disorder when you end up with, you know, the vomiting as a result of the overuse of cannabis.
Yes. Cannabis hyperemesis.
Yes. Would it give you that similar, in going back to using the nitrous, would there be the chance that that kind of progression was quicker, that you would kind of progress more rapidly to having those neuropathy kind of symptoms quicker?
I mean, just from first principles, I suspect that may be the case. Let's not forget that young student we described at the start who had just 7 days exposure to nitrous. So that was all that was needed for someone taking a very high quantity of product. So, you know, if that's not quick enough to develop psychosis and the inability to walk, then I'm really not sure what is.
There was a question asked with regard to the regulation over the home delivery service, as in, is there any regulation across home delivery, and a reference to the Queensland Summary Offences Act of 2005.
Yeah, thanks, Claire. I don't know the answer to that question. I've quoted the law in South Australia. I think, you know, part of the problem is that this is not really regarded as a serious issue by law enforcement. And let's face it, we don't believe that prohibition is a terribly effective or desirable response to substance disorders. And indeed, the Queensland government seems to be heading in that direction with plans to decriminalise possession of a range of substances for personal use. So I think where we really want to make the point is about education, so people have a really good understanding of the risks they may run and the help services which are available.
Thank you, Jeremy. There's a couple of late questions just come through, saying there were some reports that nitrous binging leads to sudden death secondary to pneumothorax, pneumomediastrum.
Mediastinum, yes, Sam, yes. Well, that's interesting. There was a report that I just saw on the weekend from the UK of 2 patients developing extensive venous thrombosis. And we've kind of come across that recently with COVID, haven't we? So COVID is now listed as a cause, as is the vaccine, the AZ vaccine. However, the pneumomediastinum or pneumothorax, that may be a result of intense inhalation and breath holding. So I guess that certainly is plausible. And sudden death is listed as a cause. So if you do have a tension pneumothorax, that prevents blood returning to the heart and can certainly lead to sudden death. So Pem, I think you're right there. So Tim's asking, once B12 returns to normal, can you take too much? I don't think you can take too much, no. So it's a pretty safe thing. Whereas we know that some other vitamins are certainly toxic in overdose. We know the story of eating polar bear liver and vitamin A toxicity. Continuous longer-term use leading to subacute demyelination of the spinal cord with resulting paralysis. Yes, that's right. So that's exactly the process. So it mimics the B12 deficiency that we see in people with pernicious anemia. That's the autoimmune condition where I should have perhaps clarified how B12 is absorbed. So it's a complex process which relies on an intact stomach and an acid environment in the stomach, and then an intact terminal ileum. So when B12 is ingested in the diet, it goes into the stomach where intrinsic factor is released. And that combines with the B12, which then travels through the small intestine to the terminal ileum, and that complex B12 intrinsic factor is absorbed through the terminal ileum. So if, for example, in Crohn's ileitis, the terminal ileum is removed, as is often the case, then B12 may not be absorbed through this active process. Likewise, if the stomach or a partial gastrectomy is performed, then the production of intrinsic factor may be compromised. The beauty is, and we probably have a parallel here with thiamine. We're all used to giving people IM shots of thiamine. There does seem to be research suggesting that high dose oral thiamine may be equally effective. So as I mentioned on one of the slides, high doses, that's 1,000 micrograms, which is just a milligram. However, one only needs trace amounts of this B12, so 2 to 3 micrograms a day is the kind of daily requirement. So if you take 1,000 micrograms, then you're ingesting many times more than the daily requirement, and it's absorbed passively, as thiamine seems to be absorbed passively through the gut. So if the concentration is high enough, then it will cross the gut lining into the circulation. So is that the end of the questions? Thanks everyone for asking. They're really good questions, because it does highlight this interesting intersection between a substance disorder and an autoimmune condition leading to ineffective or unavailable vitamin B12.
I suppose I just have one last minute question really, Jeremy, and that's given that we do have the delivery services that are quite readily available across Brisbane and the Gold Coast that I know of, do you know whether this correlates to the volume of emergency department presentations that we're getting, that we have this more readily available, dropped off at your door delivery?
Yeah, that's a good question. I mean, if we look at Melbourne, which has similar delivery services, the number of cases is surprisingly low. So I think there were 13 over 4 years, I think. Now, I mentioned that series from China, where at one hospital, they had 49 cases present within less than a year. So like many substances, and perhaps we should reflect on what's happening with vaping, there are kind of ebbs and flows, aren't there? And word gets out and everyone wants to try it, and most people try it without causing harm to themselves or others. A few people get totally sucked in and become dependent. So I think at the moment, just like there's perhaps a bit of moral panic around vaping, I think we need to highlight the risks of nitrous, but I don't think the whole society is going to collapse in a heap of subacute combined degeneration.
And are there some groups of individuals that we should kind of have more awareness that they may be at more risk of this, reduced amount of vitamin B12? You mentioned people there who may have had kind of stomach surgery, vegetarians, vegans. Yep,
that's absolutely right, Sam. So I think that those groups, so anyone who's had gastric or ileal surgery, terminal ileal surgery, who's on a restricted diet of any sort, but B12 is mainly found in meat and fish and eggs. It does exist in mushrooms, which is an advantage, I suppose. But those groups, we've seen that it's very much concentrated in the student population and young people. So, and I think, a Nang is just $1 or $2, incredibly cheap, really. Although it's only giving a very short burst of euphoria, that may be enough for some people and may encourage others to continue. So there's another question here from Pem. Thank you. What's the use of measuring MMA and homocysteine in blood? Well, I think it's kind of a sign that their B12 is seriously inactivated, leading to a backup of the precursors for those 2 enzymatic steps that I showed you. And it kind of highlights that if the patient hasn't already developed complications, then they're at serious risk. So I guess we would we wouldn't just content ourselves with measuring B12, because as we've seen in that case series, B12 levels may be normal. When you measure the B12, you're not measuring the active capacity of the B12, you're just measuring the presence of that tetrapyrrole ring with cobalt in the middle. And it doesn't distinguish whether the cobalt has been oxidized or not. So the most useful way of checking to see how well the B12 is doing its job is to see whether levels of methyl malonic acid and homocysteine are raised.